Well, monoclonal antibody is actually a very generic term that refers to many medications that are produced to be a lot like the antibodies that our normal immune system produces. There's lots of medications that are monoclonal antibodies, and we use them to treat everything from asthma to high cholesterol to osteoporosis. But monoclonal antibody treatments for COVID-19 are specific medications that are meant to mimic the antibodies that our body would produce in response to the virus that causes COVID-19. In other words, they're medications that mimic what our immune system uses to try to fight off the virus. Well, these medications are currently used to either prevent or treat COVID-19 in people who are at risk for developing severe forms of the infection. But let's focus on treatment. Currently, these medications are used in outpatients who have tested positive for COVID-19, have at least mild to moderate symptoms, and are at high risk for progression. So who's at high risk for developing severe COVID-19 disease? Well, certainly people that are over 65 years of age or who have compromised immune systems are eligible. But there are many other people beyond that that can be eligible for these treatments. For example, younger people with other medical conditions, including lung disease, heart disease, kidney disease, or diabetes are eligible. Pregnant women or people who are overweight can also be eligible. So if you develop the symptoms of COVID-19 and test positive, it's important to reach out to your physician as soon as possible to determine if you might be a good candidate for these treatments. Because it's important we give them as soon as possible after symptoms develop, and they must be given within 10 days. COVID-19 monoclonal antibodies are very important treatments to help us combat COVID-19. But it's important to note that the best way that we currently have to prevent severe disease, hospitalization, or death from COVID is vaccination.